Deep vein thrombosis is a condition where blood clot forms in the deep veins of your body, especially in the lower legs. Signs and symptoms of DVT include swelling, redness, discoloration, pitting, the feeling of tightness or compression, pain, and warmth in the affected leg. DVT potentially has a risk of causing a pulmonary edema and thus becoming a life-threatening condition. If there are signs and symptoms such as shortness of breath, pain or discomfort in the chest, a rapid pulse, or coughing up blood, you should immediately refer your patient for imaging and emergency medical care. The Wells Clinical Prediction Rule lists risk factors that can determine the probability of someone having DVT. A score of 1 to 2 shows there is a 17% probability of DVT, while a score of 3 or more shows that there is a 75% probability of DVT. There's another clinical diagnostic tool called Homan sign. In this test, the examiner passively dorsiflexes the patient's affected leg to see if there is any pain caused by that motion. However, this test has a low sense and specificity, so it should not be used as your primary diagnostic tool. Patient is a 30-year-old professional football player. First started having signs of pain 2 months ago. Patient complains of calf soreness that has been going on for 2 months, rated at a 2 to 3 out of 10, and gets worse with training. There's a feeling of tightness in the lower leg, a decreased sensation in the ankle and foot. After getting off the plane, the pain is described as throbbing and stabbing and rated at a 5 out of 10. There is no previous signs of cancer, chest pain, or history of cardiovascular disease. The athlete was a previous smoker but quit 1 year ago. During palpation, the athletic trainer notes that the calf is tender to palpate. There is localized tenderness along the triceps surae group or the deep venous system. Swelling in the calf area is noted. There's also minor pitting, but no signs of ecchymosis or bruising. Vital signs are checked and they're within normal limits. And to rule out a fracture, the athletic trainer does a bump test, which is negative, and checks the ankle using the Ottawa ankle rule. A goniometer would be used to compare range of motion bilaterally. Passive range of motion is limited due to pain, and there's a positive Homan sign when the foot is dorsiflexed passively, eliciting pain and reproduction of symptoms. Active range of motion is also limited due to pain at end ranges, but manual muscle testing is within normal limits when compared bilaterally. Based on the evaluation, the patient scores a 3 on the Wells Clinical Prediction Rule with pitting, localized tenderness, and swelling of greater than 3 centimeters, giving them a probability of 75% of having deep vein thrombosis. The patient's capillary refill is also checked and compared bilaterally, noting that it is slower on the affected side. The dorsal pedal pulse and posterior tibial pulse are also checked bilaterally, noting that it is slightly decreased, again on the affected side. The dermatomes are checked and sensation is decreased on the affected side. Myotomes are within normal limits, and the entered side is noted to be warmer than the unaffected side. Our differential diagnosis is compartment syndrome, fracture, triceps surae strain, Achilles tendinopathy, and medial tibial stress syndrome. The athlete is referred out for a compression ultrasound where they will receive compression socks, physical therapy, medication including blood thinners, and if medication doesn't work with acute cases, the patient may need surgical intervention to remove the blood clot.